Hi, my name is Stacie Egan, nurse practitioner at Ogden Clinic GI in Ogden, Utah. I am a general GI nurse practitioner, and I have experience treating patients with MASH with fibrosis. I talk to a lot of my family practice colleagues, and I do get a lot of questions about MASH with fibrosis. Probably the first question that I always hear is, I've heard about these new MASH with fibrosis drugs. Do they work? And I have to say they do. I've had my patients on these pharmacotherapies for over a year, and I've had good patient response to treatment. And so I am actively treating my patients with F2, F3 fibrosis, and we're going to get more and more therapies. So one thing that I do like to talk to my APP colleagues and other providers in family practice is that you are the gatekeepers for these patients, and we need you to help us risk stratify them. Every one of our primary care colleagues have the ability to do some risk stratification for us by starting to identify these patients with metabolic syndrome, patients who have type 2 diabetes, obesity, hypertension, hyperlipidemia. Those patients need some additional testing of FIB4 so that we can see it if they are at risk for fibrosis. And it's such an easy test to run. And a lot of our colleagues don't know about it. So it's always great to let them know that this is something that they can access either on their EMR, or there's a lot of good calculators online. Once these patients are risk stratified, if they're low risk and they don't feel like they might have additional issues, even though they're in that low FIB4 range of less than 1.3, primary care keeps these patients, and they will continue to monitor and forward them on to us, refer them to us if needed. The patients who are indeterminate, in that indeterminate range or high risk, I encourage my colleagues in primary care to refer those patients to us so that we can do some further risk stratification, get some imaging like a FibroScan, an MRE, or even a liver biopsy if needed, so that we can make sure that if these patients have MASH with fibrosis F2 or F3, that we are treating them pharmacologically and with lifestyle modifications. And if they do have fibrosis F4, that we are monitoring them as appropriate with ultrasounds and labs, and that we are able to get them to hepatology if needed for evaluation for transplant. So I hope that we can all help our primary care colleagues identify these patients and help risk stratify them so that we are able to see them in our clinics and get them the treatment they need to help address and hopefully reverse their steatosis and fibrosis. Thanks so much for joining me today, and have a great night.